excited to have, next slide please, Tatiana. Excited to have Katie Ham, the Deputy Assistant Secretary of the Office of Early Childhood Development, Administration for Children and Families, and Dr. Ruth Friedman, the Director of Office of Child Care, Administration for Children and Families, do a quick welcome for us and to launch our conversation around compensation and benefits. So I'll pass it to you, Katie.
Thank you so much, Laura. And thanks to all of you. It is really just heartening to see so many people joining us today. I think we have over 800 participants. This is such an important issue. I can't think of anything that is more pressing or more timely than how we compensate our early educators. This is not an issue that is new to the pandemic. Certainly for decades, low pay, lack of benefits has really been a chronic problem in the early childhood sector. But I think the pandemic has really brought it into focus in a new way where we have more parents, more national leaders, more media attention to this issue, and an opportunity to think about it in new ways. And we know the situation really is dire. Right now in this country, there are closed classrooms. There are family childcare providers who are no longer operating. We're hearing from the Head Start community that they can't enroll more children because they don't have the staff. And much of that comes down to compensation. If we can't pay people a fair wage, a living wage, we won't be able to retain the workforce that we need to really provide consistent and high quality services for children and families. So this really is a pressing issue, a critical issue. I know everyone joining today has a lot on their plates, and I'm really grateful that you're taking the time to discuss, to engage in some peer learning, and to hear about some of the strategies and resources that are available. Kind of at the crux of this problem is our median annual wage for a child care worker is about $27,000 a year. Or about $13 an hour. That's half of what kindergarten and elementary school teachers make. And we know that our teachers are extremely qualified for the work that they do. Within the early childhood sector, there is also a wage gap where early educators of color are paid less and have less access to workplace benefits as compared to white teachers. In 2012, African-American or Black teachers earned about 78 cents on the dollar as compared to white early educators. And quite telling is that 46% of childcare workers have incomes that are so low that they qualify for public support programs. And we saw recently some research that suggested 1 in 3 early educators experiences food insecurity. So this is an issue that not only affects our workers, but the children and families who are enrolled in programs. Our speakers today are going to discuss the compensation challenge further, including some historical and structural realities that have led to the inequities in the early childhood workforce. We really have to understand the problem fully and the historical root of the problem so that we can address it. I'm going to provide a little bit of context about what ACF is doing to address the workforce challenge and our vision for strengthening the workforce long term. So if we want to go to the next slide, this is kind of where we are right now, just looking at the pandemic. We are still missing 1 in 10 childcare workers. Compared to pre-pandemic levels. And we know that the pre-pandemic level wasn't enough. We still had a lack of childcare supply to meet demand. And we know that the number of family childcare providers is going down. And when we don't have data specific to Head Start, we certainly have heard from our Head Start grantee community that they are struggling to recruit and retain staff and haven't been able to fully open classrooms as a result. Next slide. So this is our vision at ACF for our early childhood workforce. We know that really the quality of our programs, the services we deliver, come down to the workforce. Compensation is at the top of our list. We need living wages as a floor, and we need pay parity with other types of educators. We're looking to build a pipeline so there's a path for effective early childhood educators. One of the strengths of our early childhood workforce today is diversity. More so than the K-12 system, our early childhood workforce reflects the diversity of the children and families served, and that's a real strength to be able to provide that culturally and linguistically responsive care, and we want to maintain that as we think about improving compensation and qualifications. Equitable access, it's important that children across the board, regardless of their background, regardless of their geography, have access to great early educators. And we want to make sure that there are high quality practices that the workforce has access to and can implement for children and families. If we want to go to the next slide. So I'm going to highlight several recent efforts in ACF to improve compensation in the early childhood workforce. I know we have a lot of our grantees in states and Head Start programs here today, and would encourage you to follow up with your regional office or your federal project officer if you want to talk more about this or how you can implement them in the programs that you're running. So we're working with states, tribes, territories, and Head Start grant recipients to implement the American Rescue Plan Act and those resources that are available to help with the workforce. We released a grant forecast announcing a new investment of $30 million in a national early childhood education workforce center. We released some guidance from the Office of Head Start to encourage programs to use those COVID-19 relief dollars to offer competitive financial incentives to both recruit and retain and hire staff. And just this morning, we sent a letter to all of our grantees suggesting some specific ways that they can improve the workforce. So if we want to go to the next slide, just to recap what is, just to recap what's available, we have $40 billion in ARP funds that are available to states and Head Start grantees above the normal funding level. And these are resources that can be used for all of the things that we are going to discuss today. I mentioned that there is a new funding opportunity, the National Early Care and Education Workforce Center. This is a technical assistance and research center. We will be announcing the funding opportunity in the coming months, but it's a 5-year grant that will fund research and technical assistance that will increase recruitment and retention of a diverse and qualified workforce, providing technical assistance and increasing rigorous research to build on the knowledge base and inform those TA efforts. It'll focus both on compensation as well as enhancing career pathways so that we're increasing the recruitment and retainment of our early childhood workforce. We're excited about this for several reasons. One is it really focuses on the mixed delivery setting. So it includes family childcare centers, Head Start programs, and it really looks across the Office of Child Care, the Office of Head Start, the Office of Early Childhood Development, and our Office of Planning, Research, and Evaluation so that we can focus on the technical assistance and the research together. You can follow the grants.gov website that's linked in the chat, and you can get more information and get a notice when that application is available. If we want to go to the next slide, I want to just briefly touch on Head Start guidance that came out last month. As all of you in our Head Start community know, we're hearing from all of you that recruiting and retaining staff is a real challenge right now. We hope that this guidance clarifies that you can use resources to provide competitive bonuses, both recruitment and retaining staff. We want people to think bigger and bolder and using these financial incentives to use their staff. Again, any questions, feel free to check in with your regional office staff, but want folks to think creatively and really leverage every resource available. So strongly encourage you to check out that guidance, think through how it might apply to your program. Next slide. This is the letter that we published earlier today. It's directed at grantees that implement childcare Head Start, and preschool development grant programs. It really outlines some specific ways in which those ARP dollars and other funding can be used to address workforce compensation and other strategies to promote a strong and well-qualified workforce. It also links to the guidance that I've mentioned. It also has some examples across childcare, tribal home visiting, preschool development grants, and Head Start, so you can look to what your peers have done. And we hope those examples can spur some creativity and some replication of effective strategies. If we want to go to the next slide, most states have a preschool development grant, Birth to 5, that is focused on early childhood systems. And there are a lot of ways that those grants can address the early childhood workforce, things like bonuses that a lot of folks that they were interested in doing. Those PDG grants can often be used for those purposes, wage studies, salary scales, establishing career pathways, and making professional development more accessible. So if you have any questions or want to amend your plan, check in with your federal project officer so that you can get that in your plan and start implementing that. I do want to flag that if you're at the end of your 3-year grant and you're going to be requesting a no-cost extension, you have until September 30th. If you aren't currently including workforce investments in your plan and you want to add something, reach out to your federal project officer as soon as possible so you can get that plan updated and start implementing. If we want to go to the next slide, I wanted to flag quickly, we did an entire webinar on public service loan forgiveness, that there are additional flexibilities through October 31st. Check out some of these links, see if you qualify, your colleagues qualify. It does take a bit of time to pull together the required documentation, so don't wait until October 30th. Go ahead and check out that link and get started on it now. So at this time, I'm going to turn things over to my colleague, Dr. Ruth Friedman, who directs the Office of Child Care, and she will talk about some specific ways that Ccdf resources can be used to support the early childhood workforce and compensation. So Ruth, over to you.
Thanks, Katie. Hi, everyone. I am delighted to be joining you today and certainly echo everything Katie just said about the importance of moving forward with innovations to help improve compensation and benefits for our critical workforce. The Office of Child Care published guidance last year encouraging state, tribal, and territory lead agencies to use their ARP stabilization and their CCDF supplemental funds to compensate child care staff, because we know how central that is to stabilizing and strengthening the sector. Lead agencies can use these funds in different ways to address compensation, including through bonuses, raising wages, and expanding benefits. And we have seen over the past year how critical these funds have been for the workforce, for the child care supply, and for families with young children in the wake of the pandemic. And they really have been making a huge difference. Over the last year, lead agencies have used funds in exciting new ways to support, recruit, and retain the child care workforce, doing things like increasing wages and providing bonuses, connecting workers to health insurance, increasing and improving provider payment rates, and supporting professional development. Stabilization grants have gone out to more than 200,000 child care providers, which has an impact on over 8 million children in this country. More than half of states have required or incentivized providers to allocate a certain percentage of their stabilization subgrants specifically to support staff. And our data is showing that personnel is the most common usage of stabilization subgrants in child care centers. So we really are seeing that states are using these grants in the way they were intended and have made a huge impact across the country. We think these efforts represent big steps forward in supporting the workforce and the innovative and important ways that lead agencies continue to invest supplemental funds will be critical to addressing this challenge. But as we all know, while the pandemic made a bad situation worse, low compensation was a problem that absolutely predates the pandemic and requires continued attention and continued investment. The official letter that we sent today to our grantees, to states, tribes, and territories that Katie mentioned, encourages the continuation and the expansion of these workforce compensation efforts with a variety of funds, including the ARP Act funds and direct services and quality funds. You can go to the next slide. I want to just take a moment to highlight a few of the important ways that states are using CCDF to increase compensation. Again, as I mentioned, really a lot of states are doing innovative work on this. So by singling these 3 states out, I am just lifting up 3 of many really wonderful examples. So for example, Alabama is investing ARP stabilization funding for childcare workforce grants to support recruitment and retention in the workforce. The grants provide quarterly bonus payments of up to $1,500 for eligible childcare staff. That includes all staff such as cooks, admins, owners, van drivers who are on the payroll and serve the licensed childcare facility exclusively. Providers can apply for the grants each quarter through 2023 for up to 8 opportunities to receive quarterly bonuses for their staff. And over 10,000 childcare staff members have received these bonuses. In Idaho, the state is using ARP and other CCDF relief funds to offer a child care wage enhancement grant for eligible child care programs to temporarily increase the wages of eligible child care staff. Eligible staff must receive a W-2 from their employer, work with children at least 15 hours per week, and have been employed for the entire prior month. Enrollment in Idaho STAR's RISE workforce registry is also required. That registry maintains the grant applications, documentation, and communications. And Idaho will be distributing a total of $30 million in these grant awards. The state will continue to pay monthly awards until it exhausts the available funds, which the state is estimating will be happening in May of 2023. So a really important investment. And then finally, Vermont is using ARP funds to create the state's first student loan debt relief program for early childhood educators. The Student Loan Repayment Assistance Program aims to recruit and retain early childhood educators who have recently earned degrees in the early childhood field. It will provide up to $4,000 annually to reduce student debt of full-time educators who earned an early childhood specific degree in the past 5 years. This innovative use of ARP funds means that student debt relief is available to early educators in Vermont who we think really need to see this debt relief. And so even if they may not be eligible for the limited PLSF waiver that Katie just discussed, they may have opportunities in Vermont. So these are really just a few of many examples that we are seeing across the country. We know there's a lot of exciting work happening across so many states, tribes, and territories. And we know there are many more states and local communities that are interested in learning about what others are doing and what strategies they can use to address continued shortages and support the workforce. So today's webinar will provide more depth on some of the additional examples of ECE workforce compensation efforts. Really excited to have such wonderful panelists today. And with that, I'm going to pass it back to Laura so we can get to those speakers. Thank you so much, everyone, for the work that you're doing.
Thank you so much. So we're really excited to have a great panel who's going to start to address some of the questions that you've been putting in the chat box. So please keep putting your questions in the chat box. And at the end of our webinar, we're going to have some additional polls to see if it would be helpful for you all to have some office hours on these topics. with some of our panelists, so stay tuned for that. So I'm excited to have a group of panelists who are going to share some of their experiences around strategies to support compensation. So we have Caitlin McLean, who's the Director of Multi-State and International Programs for the Center for the Study of Child Care Employment at the University of California, Berkeley. Krishana Lloyd, who's a Senior Research Scientist at Child Trends. Miriam Calderon, who's the Chief Policy Officer of 0 to 3. Phoebe Otero, who's the President of Otero Strategy Group. And Melody Redbird Post, who's the Project Director at the Tribal Child Care Capacity Building Center. Each is going to share their perspectives and their knowledge around strategies for compensation and benefits. So I do not want to take another minute of their time, and I'd love to pass it off to Caitlin.
Thank you, Laura. Hello, everyone. Welcome. I'm very pleased to be joining you today from the Center for the Study of Child Care Employment at UC Berkeley. Can we move to the next slide, please? Thank you. So you have all heard, and I'm sure are already aware, that the need to address compensation in the early care and education field is urgent. Next slide, please. On the screen is a quote from a center teacher that we heard from as part of our California workforce study, where we surveyed educators in late 2020. She says, "I feel trapped. I would stay in the field if the pay, benefits, and protections were better, but I can't get out of it soon enough, the direction things have been heading." And she's not alone. Next slide, please. Educators across the country are struggling financially and emotionally in one of the worst paid occupations that you can have in this country, facing poverty and food insecurity at rates far above other workers and other teachers. Not surprisingly, many educators are leaving for better paying jobs elsewhere, threatening to collapse our entire industry, with impacts that will reverberate across our economy for the many children, parents, and employers who rely on early care and education services every single day. And while the racial, ethnic, and linguistic diversity of our field is a great strength, poor compensation and inadequate working conditions contribute to and perpetuate unacceptable economic insecurity and inequity for women of color, both within our own field and across our society. Disparities even within our own workforce mean that some educators are worse off in a field that is already heavily disadvantaged. As Katie highlighted earlier, research from our center has documented racial wage gaps in which women of color earn less than their white peers for doing the same jobs. Black educators, in particular, earn over $4,000 less per year than their white counterparts. And these inequities are baked into the existing structure of our early care and education system. Infant and toddler teachers routinely earn less than teachers who work with preschool-age children. And Black educators are more likely to be working with infants and toddlers. So when we continue to treat the care and learning of our youngest children as less important, we're directly contributing to racial inequity in our field. Next slide, please. We all know that we need public investment in our workforce urgently to combat this crisis. And while efforts at the federal level have largely been stalled since the passage of the American Rescue Plan Act, states and localities across the country are finding creative ways to get resources into the hands of educators who need and deserve them. Our research center has been tracking these efforts in a publicly accessible database. We look at efforts to raise wages, provide benefits like health insurance and paid leave, and other payments to the workforce like short-term bonuses. Next slide, please. And here are just some of the strategies that we've seen so far. We know that some states have used ARP stabilization grants to encourage or require programs to raise wages or provide direct payments to staff. States like Minnesota, that included a requirement that a certain percentage of funds go toward compensation, and many other states that have offered extra funds if programs agree to use this money for compensation. And some states are sending the money to programs, but instead of relying on program discretion around how to use the compensation funds, the states are specifying how much should be paid to staff and in what way. For example, in Utah, they offer an extra amount of money for providers who agree to pay $15 an hour for at least half of their staff. In Kentucky, they're doing something similar for programs to be able to reach $10 or $13 an hour. And in Maine, they're using their stabilization grants as well as additional state funding to pay $200 monthly bonuses to staff, again, going through the employer. And we've seen in states like North Carolina and Rhode Island that given the resources and appropriate guidance, program leaders can and will use the funds to address compensation. In both states, programs could receive additional funding if they opted to use part of their stabilization grants for some form of pay or benefit increase. And in both states, over 90% of programs opted to do so. In other states like New Mexico, they're sending payments directly to educators and bypassing programs. New Mexico contracted with a third party to send checks to childcare teachers to provide short-term bonuses using COVID relief funds, and they're taking a similar direct payment approach for their pre-K teachers to achieve salary parity with K-3 teachers. But we hear from state leaders that despite these wins, finding funding and political will to cover benefits for early educators remains a challenge. But we can learn from some states like Washington that have used public funds to cover healthcare premiums for early educators who are not eligible for Medicaid. Each of these examples are things that all states can and should be doing immediately with pandemic relief funds to help relieve the immense economic stress that educators have been facing and continue to face. Next slide, please. Moving forward, we need to get out of crisis mode and begin laying the groundwork for meaningful and transformative change in our field. We need to make early care and education jobs good jobs that young people will be proud to do and that won't require them to put their financial futures in jeopardy. Jobs with professional level wages and benefits like health insurance, paid leave, and retirement. Jobs that will reduce rather than exacerbate racial and gender inequities in pay and access to wealth. And we can look to the many examples of communities across our country for how to move toward that vision. Places like the District of Columbia, which raised local revenue through a new wealth tax for a dedicated pay equity fund for early educators that will ensure that all early educators in the district are paid on par with teachers of older children, including explicitly infant toddler teachers, who across the country are more likely to be Black educators. And we can look to places like Illinois, where they're using PDG birth to 5 funding to pilot contracts to programs that require staff to be paid on a salary scale. We know that stable funding mechanisms like contracts and grants are critical to enable programs to sustain higher wages. And we know that moving forward will take significant public investment. So I urge you, keep up the pressure on federal leaders who need to act to secure meaningful additional funding and reform for early care and education services. The many efforts to improve compensation by state, local, and program administrators using ARP funds cannot be sustained without future funding. If you're a state or local leader, consider what you could be doing to address wages, benefits, and working conditions for early childhood educators, both in the immediate and the longer term. Things like using those pandemic relief funds to explicitly encourage programs to use the money for compensation. Continuing the use of stable payment mechanisms for programs like grants and contracts, using what you've learned from the stabilization grant process or from contract pilots like in Illinois. And really preparing for longer term change by engaging early educators in a process to develop professional compensation standards that are at least equivalent to what teachers of older children are paid, and developing a cost model to understand how much public revenue it will take to realize those pay increases. Lastly, if you are a program leader, thank you so much for everything that you have been doing to keep your program afloat and to keep yourself and your staff going through this incredibly difficult time. I know you are doing what you can to pay educators more and that you need more public funding. And that's why I urge all of us to make the early childhood workforce a priority, not an afterthought. Thank you very much. Next slide, please. If you want to think about this a little bit further, I've included resources in my slides. Thank you again. And now I'll pass it off to Dr. Lloyd.
Okay, thank you, Caitlin. I'm going to chat. I don't have any slides. I'm actually on vacation and ready to hit the beach when we finish up. So happy to be here, but also really ready to take a break. So I'm going to take us turn back a little bit. And Caitlin shared a little bit about some of these innovative things that were happening at the state level. So I'm going to take us back a little and kind of talk about why we're where we are now. And why we see these efforts kind of at the state level, and why we need to be switching to really think about this public investment on the federal level. So I had my kids ask me one day, like, Mommy, what are these papers that you keep talking about? And why are you always on these videos or whatever talking about racism and discrimination in childcare? So I'm going to, since we have 10 minutes only, try to do this and explain this in a very simple way, in the way that I talk to my children about it. So basically, if we look at the history of early care and education in the country, started going back to like the 1600s, right? We had indigenous people who were here meaning the United States, which wasn't the US at the time, kind of minding their own business is what I said to my kids, right? They were doing their own thing. You had European men who came through. They decided that they wanted to stay. And not only did they want to stay, they wanted to kind of take what was already in place and make it theirs. Okay. And so they did this by force, using rape, murder, making the indigenous people sick with diseases, stealing land, basically whatever it took to get a foothold in the land, and get that foothold to make them prosperous, right? And to generate wealth. So capitalism was kind of at the bottom of this. And alongside this invasion, the King of England kind of decided, well, those guys over there, they need some women. There's no way we can have them kind of hanging out willy-nilly, taking all these resources without some grounding, some family to kind of keep them in place. Families need to be there so they can be stabilized. So European women were solicited, and they were paid to be wives, to partner with the men and to have children. And that was really their sole function, to have babies, to raise them, and to kind of keep house, to be domestic. It wasn't thought that they should be able to read, only in instances of maybe learning about the Bible, right? So we've got capitalism here. We've got this Christian kind of foundation to the country. Now you fast forward a little bit, and then you've got some Black people coming in from Africa. They were forcibly taken from Africa, from their land, from their children, from their homes, and they were enslaved. And that institution, that process grew very rapidly. There were kind of 20 in the 1600s, and ships kept coming, more people came. And so where Native Americans, kind of the indigenous people, were familiar with the land, they had their own languages, they had weapons, they understood what was happening on the land, they were outnumbered clearly and didn't have guns and things like that at the rate that the European settlers did. Black Africans were stuck, right? They were really dependent on their captors. Some were even sold to Native Americans to be enslaved. And so this institution of chattel slavery within that system of people kind of coming over became institutionalized and the foundation of the country. People being owned, bought, sold, traded, adults, children, men, women, no relationships were sacred, none recognized. And also important here is that the lineage came from the mother, right? So if the mother was enslaved, the children were also enslaved. So that's kind of the foundation of the country and where we are. Important in that is understanding this role of women. So white women, as I mentioned, were kind of in the home doing domestic work. That's why they came, right? And were solicited to be here. And when this institution of chattel slavery started, you had Black women who were then in the home, right, doing that work, breastfeeding, raising children, doing other domestic duties, cooking, cleaning, etc. So you have this kind of complex dance that was going on and this relationship between Black women and white women during that time, where both were kind of relegated to the home, to the personal realm, but different levels of power, different levels of resources within those relationships. At the end of the day, though, women were devalued. Their place was thought to be in the house, at least for white women. Black women were also working externally to the house, right? But this was a private issue where childcare, domestic duties became in-home issues. And so that's where we are. And so when you think about kind of the history of early care and education and the roots and genesis of childcare and what that means, that's where it started. You also saw as children were being sold, as Black women were being sold, moved away from their children, this issue of kinship care developing, right? So babies who may have been left behind, young children who were left behind, other women, Black women stepping in to care for them. And that thread you see throughout our history. And so what you then have then is women being associated with childcare, which is a private issue, domestic work, which is a private issue, and the devaluing of the field. And that's been in place for a good part of our country's history, particularly when we look at Black Americans. About 75% of the time our country has been in existence, there have been intentional laws and policies that have disadvantaged Native and Black Americans. And we see that with the increase in immigration, other brown women as well, too. And so, that's where we are. That's kind of how we got here. So what does that mean? I have about 5 more minutes to kind of shift gears to where we are now. There are some key things that are happening here. We've got differences, as Caitlin mentioned, and as was mentioned earlier, around kind of who's doing what. So you have Black women, brown women who do a lot more of the care for infants and toddlers, who do a lot more of the work in home-based childcare. And that's intentional. It was a very intentional strategy to kind of remove themselves from particular situations, from the lives that they had in the homes of white women, to be entrepreneurial and to not be in systems, right? And so that attitude, that spirit of kind of resistance still carries through. So that's one thing that we see pretty clearly. And we've already talked about kind of the wage differentials in there. So one of the things as we think about kind of raising this floor, we still can't ignore these gaps, right? So as we're raising the floor, we have to understand that Black women, brown women are still very much behind in terms of compensation, and compensation meaning wages, access to benefits, and other resources in the field, professional development, et cetera. I know Rhode Island was mentioned. We've been doing and having some conversations with Rhode Island. And one of the things that they've really been thinking about is having these conversations with center-based workers and with home-based childcare folks together, right? Because they were going to the table and talking about, kind of these limited funds and advocating for funds, but not doing it together, right? So, somebody would get something and the other person wouldn't, and it wasn't kind of a full team. So thinking about that is really important, having people kind of centered at the same table. The other thing that's really critical here is we have these states' rights. And so because of what was happening with chattel slavery and the institutions in the South, states were kind of making up and allowed to do their own thing, right, in order to become a union. And again, that's kind of part of the history we don't have a lot of time to get into right now. But as a result of that, kind of the payment for early care and education workers is low. in general, but it looks very different across different states, and states make very different strategies, right, which we heard a little bit from Caitlin. And so as we think about kind of this move forward, we really need to not only think about these place-based financing models that, think about high quality early care and education that employ well-compensated professionals that have attention to, equitable compensation for Black and Brown people that are in the field. We need to be thinking about what's happening at the federal level and how all of those federal dollars that kind of trickle down to these states, PDGs, everything that was kind of mentioned, how to hold people accountable for their use of those dollars in a way that really recognizes diversity in leadership, diversity in policymaking, even diversity in the research that we do, right? And we're grappling with some of those own issues at my organization. And so those are kind of two big things. I have several more that I'd love to touch on, and maybe we'll have an opportunity to do that in discussion. But those are the biggies, kind of thinking about as we raise the floor, there's still this existing gap, and what do we do with that, which is really based and rooted in our history. I also think, which I didn't touch on a little bit, we need to be changing the narrative around early care and education and what that means. So potentially doing a little bit more partnering with the Department of Education. So for example, Maryland is doing some really great work in thinking about how you bring home-based child care providers in to support the advancement of universal pre-K. But it also disadvantages them, right? Because you have teachers who are paid and funded by Department of Education, who are being compensated and have benefits and summers off and retirement and all of these things that if you have home-based providers that you're bringing into that same system to support that system are not getting those benefits. Again, that lack of equity. So let's think about, what we do with that, how to address it at a state level, and how to use those federal dollars to hold people accountable in that federal oversight. That is my alarm. So that's my 10 minutes. I'm going to pass it on to Miriam, and she's going to focus on compensation considerations for bi and multilingual staff. So, as we talk about, again, kind of this increase in Brown people, even Black people who are coming from other countries who historically have not been enslaved in the United States, but maybe coming from the Caribbean and African countries who are also moving into the childcare field. We really need to be thinking about, some strategies and how to address those issues too. So I'll pass it on to Miriam, who will share some highlights and strategies from Head Start and other states. Thanks for having me.
Thank you so much, Dr. Lloyd. That was great. Really enjoyed that. I also want to thank Laura and the ACF team for including me in this really critical conversation. So I am going to take sort of the 10 minutes the same. I'm just going to sort of talk through some thoughts, no slides, but really wanted to offer kind of some of my own lessons learned in implementing different kind of wage and compensation policies from for early childhood educators and childcare staff, and really drawing from some of my experiences in Oregon and DC. And I kind of want to make 4 main points today. One is that you have to be absolutely intentional about wage policies if we want to see progress. Clearly what Dr. Lloyd covered, given the historical context and the institutional and structural inequities we are up against are real. And so it really does take intentionality. I think it also takes a willingness to be able to take risks, learn equally from what works as well as what doesn't work, and be able to talk about that. I think given a lot of what Ruth and Katie covered in the opening, clearly we're at a time of a lot of innovation and trying things, which is super exciting. I also want to sort of close with some thoughts around my perspective that I think we need more breakthroughs, specifically for infant toddler teachers, and that we really need to pay special attention to immigrant women working in this field and compensation issues. So first, I'll start sort of with the point around intentionality. I think, this might seem obvious, but I think it bears kind of saying again that and saying out loud that I think that really relying on cost of care, implementing cost of care alone as a strategy, or increasing reimbursement rates as a strategy alone really is inadequate and insufficient to ensure that we realize salary increases for the ECE workforce. So I'll share kind of some lessons learned in DC and some contrasting experiences. I helped to implement universal preschool in Washington, D.C. I was working at a school district at the time where our preschool teachers of 3 and 4-year-olds were part of a collective bargaining agreement. It was sort of my first lesson learned about how powerful collective bargaining policies are as a really important tool for wages. At our time in the district, the preschool teachers working for the school district under that collective bargaining agreement were compensated the same as teachers of older children. Our teachers' assistants were compensated on the same pay scale as teachers' assistants working with older children, although that was definitely a concern at the time because we knew that the duties were not the same and the expectations for given co-teaching in preschool classrooms. But nonetheless, we had also at that time teachers in all of the Title I schools in our district who were also Head Start teachers because we had a blended Head Start universal preschool model. So all of those teachers were compensated under the same collective bargaining agreement. We also at that time in the district had preschool, we were implementing a pay for performance policy. So there were significant bonuses available to teachers in our district. We had teachers who were making upwards, Head Start teachers, because they were all, Head Start UPK teachers in the Title I schools, making some even making 6 figures, those that had tenure and those who were recognized for their exceptional kind of teaching skills. In contrast, years later, working same city in the district, working on compensation and trying to think about strategies for community-based childcare. We look to policies like increasing reimbursement rates year over year and making some of those investments there. I think that was sort of a first early light bulb for me that we were assuming that some of those strategies like increasing reimbursement rates were going to translate to salary increase, but we really had no way to ensure that, no way to track that from a data perspective, really no understanding of, who was benefiting from some of those reimbursement rate increases in terms of higher wages and as a result of those investments. Another point and another experience I want to share kind of around intentionality is an experience we had in Oregon where we really teed up an investment for the legislature in Oregon explicitly to raise the staff to raise the wages for Head Start and early Head Start teachers. So we went to our legislature and asked for $40 million to raise wages for Head Start and early Head Start teachers in our state. Something that's interesting to know about Oregon at the time is Oregon has two state preschool programs. One is a direct investment in expanding Head Start in our states called Oregon Pre-Kindergarten. So all of the state's Head Start and early Head Start programs are dually funded with state and federal investment. And so, it was really difficult, I think as many of you can imagine, really asking the legislature to spend $40 million and not realize additional slats and services for children. But we had to be really clear about the fact that, without making this investment in Head Start, in our Head Start programs and in the staff and wages, we weren't really going to be able to realize any additional services. We brought forward examples of, how Head Start lead teachers were making less than bus drivers in their local public school. Also kind of important at the time is Oregon had a second preschool program, which was a much smaller investment called Preschool Promise, and that was a mixed delivery preschool program. So those preschool dollars were available to Head Start programs, public schools, family childcare providers, community-based childcare programs and centers. And as we were expanding that program, we were seeing within inequities within the mixed delivery system. So that program had built in salary scale and very intentional wage policies. So as we, funded, we could see, for example, a program where Head Start received this preschool promise funding stream and had to pay and had resources to pay those classroom staff more than they could pay for their Head Start teachers also doing the same work, teaching preschool age children in their same program. The second point I want to shift to is sort of taking risks and the point about lessons learned and kind of what does and doesn't work. One of my early experiences, again, in DC with trying something and learning from it was being involved in the district's strategy years ago around early Head Start childcare partnerships, an initiative in the districts that is known as the Quality Improvement Networks. So we built into that model early on bonuses for staff. And after we were committed to it, we had a stake in the ground. We said, there's absolutely got to be a guarantee and an intention that that the providers that are working as part of the quality improvement networks, in more than training and technical assistance and all the supports that they're going to receive, that they are compensated, and we wanted to be very targeted about that. So we looked at a strategy of providing bonuses. After the payout of the first bonus, we had some of the programs involved in the quality improvement networks tell us that they had staff leave. When we inquired about that, again, we thought this was a fair policy. We wanted to do something on wages. And we thought, of course, it would help with retention, sort of one of our hypotheses. Some of the feedback that we got back from the programs is that some of the staff said that, now that they had a bonus, they were, able and ready to move on and maybe looking for work that could pay them more and be more stable in the longer term. With more working conditions. Now, I want to qualify this. This is a very small N size. So, but I think it was, a powerful lesson. It sparked conversations. I remember at the time we had folks saying, maybe we shouldn't have paid the bonuses all out at once. Maybe that was our mistake. And we're like, no. What are we even talking about here? Like keeping people, keeping people spreading out a small bonus over a longer period of time doesn't seem like the right strategy. So, but I guess the point I really want to make there is we didn't see this as a failure, right? But a lesson to learn and improve upon. And I know BB is up next and going to talk about where the district is going now, which is so far ahead of those early experiences. In Oregon, as I mentioned before, we had, 2 different preschool programs. I just want to say a quick note about our mixed delivery preschool program, which is really one of our very, very small investment at the time, but put a really important stake in the ground about wage policies. But I think that felt risky at the time because it represented such a small share of the overall public funding available for early care and education programs across our state. It was really hard to know what the impact would be. So we really tried to learn from implementation. We saw programs take different approaches, right? So because we built the resources were cost per child and we were never really funding whole programs at a time, we just didn't have as many funded slots and enough resources to be able to do that. So we were back to seeing, different programs, whether, they fund one classroom through Preschool Promise. And so we knew we were potentially perpetuating some of those within program inequities again. But we saw other programs experiment by spreading the slots across different programs, trying to fundraise other dollars so they could raise wages all at once. Again, we saw some of those programs hover sort of at the minimal end of our salary scale, but we knew they were really trying to navigate through some of those within program inequities that we saw. Another lesson from the enhancement that I mentioned in our state, the $40 million investment in Oregon Head Start, was, a lesson learned was really seeing how programs grappled with the realities of paying classroom-based staff at the implementing the salary scale once they got those resources at higher levels than other staff, right? At some points, because of other positions in the program, weren't funded at levels, education managers, had lower salaries, family services staff. And so a big lesson learned there was really thinking about how do we give programs the maximum level of flexibility to be able to use these resources for staff outside of just classroom-based staff. And again, giving them minimums and maximums in our salary scale, understanding that programs are all at different starting places. I think my time is wrapping up, so I just want to say just a couple thoughts. I do think we need more breakthroughs with infant and toddler teachers. We see these within program inequities for the teachers of infants and toddlers. We know our public policy requires less in terms of credentials and the link between credentials and degrees and compensation. In Oregon, we tried some things with contracted slots and a pilot of that program to build in wage policies. We also looked at providing a higher cost per child in our preschool program, so a higher rate to serve preschool age children in small family childcare homes in rural communities. And that higher rate we calculated as a basis of really being able to pay staff more and allow those small family childcare home providers to be able to hire an additional staff person to be able to support the mixed delivery model. And again, the public funding, the amount we had for infant and toddler versus preschool age children in our time in the state was so much smaller, but we were trying to learn, I think, from some of those strategies. But again, I think some of the breakthroughs that we're seeing now in the field, as you heard about from Caitlin around including infant toddler teachers in bonuses, what we're seeing in strategies and ARP, I think is super exciting. It's really starting to help make me question, in light of the fact that we're not, close to sort of having universal financing for early care and education in states and communities, that we really question the efficacy of some of the building it into the cost per child. And I think really looking at, subsidizing the overall operating cost of programs as a promising strategy, or really thinking about, what are we learning from what's been happening in ARP around including infant toddler teachers. And last point I'll make is really paying attention to the issues of immigrant women in the field. It is critical, obviously, to retain them in the field. We have 1/3 of young children come from homes where languages other than English are spoken. Again, I think that link to credentials and wages can be particularly challenging for immigrant women. We have to start thinking about their access to credentials in their own languages. As long as these two issues are linked between degrees, credentials, and wages, we need to be able to pay them, pay these providers for their language skills. You heard about New Mexico's efforts to provide supplemental wages. They are also including a one-time incentive payment for bilingual staff. And then finally, I think we need to be mindful of kind of some of the immigration issues in our compensation strategies. And I'm going to stop there because I know that's something, an issue that Bibi will touch on as she talks about DC's efforts. So with that, I'm going to hand it over to Bibi. Thanks so much.
Thank you so much, Miriam, and very much appreciate being here. Thank you, Laura, for having me, and to ICF. So ditto to everything that Miriam said about DC and how we learned from DC, from these past experiences in DC. So next slide. So I'm going to speak about what the compensation strategy at this moment is in the District of Columbia, given all of what we've learned. Next slide. I want to make sure that we have a chance to look at policy, regulations, and advocacy as sort of the strategy to get to where we are, and then talk a little bit about where we've landed in terms of compensation. So from a policy perspective, in 2018, we, and Miriam was very involved in this, as was Shana, we passed the Birth to Three for All DC Act of 2018, and it mandated, and this is a really critical piece to put into legislation, compensation equivalent to the average base salary and fringe benefits of an elementary school teacher employed in the District of Columbia Public Schools with the equivalent role, credentials, and experience. So we set the marker at in this policy piece so that it was etched in stone, definitely, in terms of making sure that we would get to parity. Whatever strategy we took had to get us to parity. We focused on birth to 3 because, as Miriam mentioned, in 2008, the pre-K for all DC provided publicly funded pre-K for 3 and 4-year-olds. The pre-K teachers and assistant teachers in community-based settings were receiving the same base salary as DC public schools. There are still the issues of benefits and other and salary scale, as Miriam mentioned. But the focus on birth to 3 next was because of the fact that we already had the universal pre-K. Next slide. So from an advocacy perspective, the birth to 3 was clearly a combination of 2 decades of working on building advocacy and equity in our early childhood system, and wanting to make sure that we were really looking at it from a systems perspective rather than one part of the system. So we'll get you a link to the birth to 3 law, but it really covers much more than the child care piece. It looks at home visiting, and it looks at a number of other aspects of the system, some of our health aspects and so on, so that by full implementation of this law, we're really looking at all of the services that are for young children 0 to 3, their families, as well as their caregivers. This coalition that helped pass the legislation then became the Under 3 DC coalition, and it continues to be funded primarily by philanthropy. And I think this is a really key piece to look at, because philanthropy has really put a stake in and funded a significant amount of dollars into making sure that there is a coalition and that that advocacy is in place in terms of being able to move the policy decisions and the next steps towards implementing parity. So this coalition brings in organizations, parents, grandparents, providers, and it really has served as an education piece for making sure that we have community support across the board on the needs of children birth to 3 and in childcare and in health. The first 3 years of since this legislation was passed, we did not get the funding necessary for the compensation provision. Next. So we'll move to, so the other element of this was regulations. At the same time, the State Office of Education, and remember DC is both a city and a state, and so we have a lot of we have the state responsibilities also. And so our licensing requirements were revised, and I think it's important in terms of the requirements for credentialing for teachers, home-based providers, directors, et cetera, so that ultimately you'll see that linking back to the strategies for compensation. Next. So how did we secure the funding for this? Next. So the funding is, it was going to be, everybody has talked about the need for this to be public funding. Very difficult in moments when there are so many different needs for us to try to just coalesce around one particular area of work. So we worked very closely with other coalitions across the District of Columbia, and we're able to focus on a modest raise for personal income tax to the highest income individuals. So we had a strategy and a set of principles that focused on tax justice and correcting inequities in the tax structure. And so high income individuals at that time were paying less than middle income. And so in partnering with other strategies across the city, we agreed that if we were able to get this tax increase, then we would be able to support early care compensation, specifically housing support, and the local expansion for the earned income tax. And of course, all of these are the same issues that all of our families who in the district needs. So this was an easy coalition in many ways to forge. End result is $75 million for implementing the early education compensation piece. So these are fixed dollars in the overall budget for the District of Columbia. I think we've heard everybody talk about the fact that we've got to have public dollars, and we have to have dollars that are stable and ongoing rather than one time. This level of funding, we don't believe will also get us to benefits, and we'll have to have a strategy for how we add benefits to the mix. Next. So the implementation, originally the legislation, and I think Miriam touched on this too, was reimbursements through the cost of care. We quickly realized both the State Office of Education, the council, and many in the community raised issues with this approach and the equity issues around that approach. And so once we were able to secure the revenue, we then requested that it be placed in a non-lapsing fund so that we had time to work with community around the distribution mechanisms. And so the Early Educator Equitable Compensation Task Force was appointed by the City Council, and it was tasked with recommendations for and a plan for distribution. And they had a very short period of time between October 21 and March 22 to come up with a plan, because the dollars were already coming into the city budget. Next. Or the city coffers. So bottom line, these are the summary of recommendations. The task force came up with a recommendation, sort of a two-phase strategy. Phase one was short-term mechanisms of supplemental payments direct to educators. And as you see in that list of bullets, it was direct to educators through the State Office of Education that in fact has decided to go through a third party that's going to do that distribution. Individuals eligible opt-in supplemental payments are graded based on roll only. I think that's really important. These supplements are not based on credentialing. They're only in terms of lead teacher, assistant teacher, both at center-based as well as family childcare, regardless of whether the center receives children under subsidy or not. So this applies to all licensed centers and family childcare in the district. During this time, the state office is to focus on an infrastructure to develop a data system and financial planning supports and TA for providers, as well as prepping for what the long-term mechanism will be, and of course, data collection for purpose of spending accountability and so on. The second phase, the second piece of this set of recommendations is long-term mechanisms. So a new salary scale that is program funding, and it will be, funds will flow directly to facilities, separate and apart from subsidy funds. So this is a separate piece of money that will go to homes and centers. A salary scale will be implemented with gradations based on roles, credentials, and experience. I shared a little bit earlier the fact that our regulations change. Those regulations also provide a waiver for 10 years of experience in a licensed child facility. And so keeping in mind that some of our providers, some of our teachers and our educators may in fact have 10 years of experience and not necessarily get the formal credentials. So we wanted to make sure from an equity perspective that we were really paying attention to that. Program level funding formula, accounting for a base amount reflecting the number of teachers and the assistant teachers. So this will be a pot of money that will go. And then obviously focusing on an infrastructure and data collection. Next. This is the initial proposed minimum salaries. There is a different chart with what the salary scale looks like, but this gives you an idea of what the minimum salaries for assistant teachers or associate caregivers, teachers or caregivers. Again, center-based family childcare. Next. This is a list of considerations that were included in the recommendations from the task force, paying attention to cash flow, that is an issue that we always deal with in that we have to try to see if there are ways to align basically the way public education gets its dollars, which is making sure that those dollars come up front so that providers aren't having to upfront the dollars. Technical assistance being really key, evaluation of the compensation program being really an important piece in this. And then as was said earlier, there are really some equity concerns, undocumented educators, language access provisions, individuals with limited literacy or tech literacy. So really working with community to make sure that we are paying attention to those issues that really may, if not attended to, may keep a number of people away who have dedicated their lives at very low incomes, keep them away from being able to access these funds. Next. These are some of the challenges. Obviously, one of the biggest challenges was making sure that there's a centralized data system for our workforce, which is why the first step is to do supplementals until such time as we know that the data system is strong and really reflective. The benefit cliffs in the short term and the long term. So in the short term, we are able to support the district has passed legislation so that folks aren't kicked out of their social supports while they're receiving these supplementals. And then we'll have to do that and figure out how to move away from, once we stabilize folks, our educators' salaries, then there'll be less reliance on those social supports. But there's a clip here and there's a period of time that we have to really be concerned about that. There are tensions and trust issues, employer to employee, in terms, particularly when we go to an employer funded fund, will all the dollars go to employees? And that's why we want to take some time to build an infrastructure to make sure that employees are protected. I can't emphasize more how important communications and messaging is around this issue. It is really critical that there is coordination between the state as well as the community as to how we message this issue. We need to pay attention about credentialing again, especially with immigrant teachers with credentials from other countries and so on. And ultimately threats to funding. This is a wealth tax, and that, like any other tax, could be impacted in the future if there are budget constraints in the state. Next. So just these are the next steps that we'll be taking. The council has accepted the task force recommendations for the permanent compensation program. It needs to codify this into law so that regardless of who the administration is, we will continue to have these resources and it will be spent in the way that it has been codified. And the State Office of Education needs to distribute the pay supplements. The first supplement will go out in September, $10,000 for assistant teachers and $14,000 for teachers. I think I have come to the end of my time, and so I will pass it on to Melody.
Awesome. Thank you so much, Vivi. That is wonderful information to share. Hello, everyone. I hope it's a beautiful day wherever you are. I'm Melody Redford Post, and I'm the project director of the Tribal Child Care Capacity Building Center. And I come to you from the traditional and contemporary homelands of the Kiowa, Comanche, and Chincha in South Oklahoma. So I'm really excited to be able to share with all of you just some highlights. And I know we have a few minutes left, so this will be just kind of giving a quick summary of basically what our team has heard from tribal CCDF administrators over the past year, especially as tribal lead agencies really move forward with implementing their initiatives and activities under all of the COVID relief funding, as well as they really come out of the pandemic and really think about recovery from the pandemic. So just wanted to share some highlights of what we have heard as we've been having these conversations and providing TA with tribal aid agencies. So I'll go ahead and first kind of start off with some of the challenges that we've heard. Many of these challenges you've heard from our other panelists here, but as some of you may know, tribal nations and tribal communities were hit very hard by the COVID-19 pandemic. And that meant that tribal nation government headquarters had to go on lockdowns and just putting into emergency procedures and protocols that weren't in place before. And all of these kind of created this situation where now tribal communities, as tribes kind of reopen and as CCDF administrators look into reopening, really thinking about how do they rebuild their workforce? Because during the pandemic over the past couple of years, they've lost staff due to COVID. They've lost teachers. They've had to close their tribally operated childcare centers. And then, a lot of staff had to make a decision, make a choice between keeping their job or going home to ensure that their children did the virtual schooling during the pandemic. So all of these really created this kind of perfect storm. And so with all of that in mind, now as tribal aid agencies really think about ways to implement these COVID relief dollars, our team has really been focused on supporting CCDF administrators in developing implementation plans for the ARP Act Child Care Stabilization funding. And so through our conversations around that, we've heard some really innovative practices that have been just kind of identified by CCDF administrators. So I wanted to highlight a couple of strategies that we've heard that are kind of just this response to trying to emerge and recover, but also think about moving forward. So one strategy that we've heard is really thinking about building apprenticeship programs that support really recruiting the early childhood teacher workforce. And so basically building their own early childhood workforce from their community. And so one tribal nation is implementing this apprenticeship program, and it serves a dual purpose. It spans over several years, and they have an application process that people who are interested, they would apply for it like they would any job. At the end of their apprenticeship program, they would agree to a certain period of time to serve as a teacher in the early childhood center. The program, this particular tribal nation has partnered with their local university to design a curricula that support these early childhood teachers in obtaining their teaching credentials. And whatever that looks like, whether it's going for their CDA or for their bachelor's degree, whatever the credential of their focus is, but really having them in this program as a cohort is the idea. And along with going and getting their education and moving toward that early childhood credentialing, this apprenticeship program also includes tribal language. So these teachers who sign up as apprentices will actually become language speakers to then be able to speak their tribal language with children that they'll teach eventually in the classrooms. And so apprenticeship programs, I think, show a lot of potential. And it's been very exciting to hear some of these stories and some of these ideas where in tribal communities where they're trying to implement these. Another strategy we've heard that has worked well is CCDF is really all about coordinating and coordination, collaboration. And so the CCDF administrators have found that they've needed to reach out to other tribal programs within their nation. So reaching out to their workforce program, to their tribal youth programs, to other programs within their tribe, and really thinking of how can they raise awareness of early childhood as a profession And so they've actually started doing outreach through partnering with other programs to go speak to middle school youth and high school youth to really get them interested and get them prepared to be able to apply to fill some of these early childhood positions. And then I just wanted to share another just key point is, and I saw this in the chat box as well, and I know this has an echo is the fact that these COVID relief funds, and particularly the ARP funds, they have a limited time frame as far as obligation and liquidation. And so a lot of tribal leaders are hesitant to make big changes in staffing and wage compensation because of the time frame, the deadline. And so that creates a lot of challenges for CCDF administrators who are doing everything they can to give incentives and bonuses and really trying to think outside the box. But with this knowledge that if they do try to do some wage increases, it will only be for a limited time. And so that, is a problem eventually that everyone will have to deal with. So that's been something that we've heard a lot, is just kind of the anxiety around what are we going to do when the funding runs out, and how will our tribal nation continue to sustain our workforce after that point. So with that, I will go ahead and stop there and turn this back over to Laura. Ahode Baha, thank you for the opportunity.
Thank you so much. I really appreciate your comments. So I know we are bumping up against time, and I want to make sure that we have time for a couple of polls because we really want to continue this conversation with all of you. And thank you so much for giving us an hour and a half out of your day. So Tatiana, let's launch those last two polls really quickly.
The first poll is launched, so we'll wait a couple of seconds to let people respond.
And I do not see it.
We are receiving responses, Laura.
Okay, so I'll let you read it if you could, because I did not see it on my screen.
The question says, are you interested in attending a discussion-based office hour to learn more about how to support ECE workforce compensation in your jurisdiction or program?
And then Tatiana, if you want to go ahead and let the other poll, go ahead and read the other poll so we can get both pieces of data, that would be great.
The second question asks, what compensation strategies would you like to learn more about? Check all that apply. Increasing provider payment rates, implementation of bonuses and wage supplements, improving access to healthcare, improving access to other benefits such as retirement, developing and implementing a salary and wage scale. And if for any reason you're not seeing the last polls, it could be because you are not on the latest version of Zoom. Thank you.
So go ahead and launch those results.
A couple more seconds as folks are still answering, and then I will launch the results.
So I can see the evaluation poll 2 results. It looks like people are really across the board interested in all of these topics. And we really thank you for this input because it really helps the Training and Technical Assistance National Centers to be targeted with our information to you. And what was the result of the first poll? Oh my goodness, a whopping 80% are interested. So we will work with all of our colleagues and the Office of Child Care and ECD and OHS to think about how we can put together some office hours with some of the presenters that you met today so that you can continue these important conversations and share strategies across the board. I want to thank today's panelists, Caitlin, Prashana, Miriam, Bibi, and Melody for sharing their expertise. I want to thank Katie and Ruth for your amazing leadership and responsiveness and making sure that we are all helping and moving in the same direction to support the field. We have amazing additional resources for all of you on the call. Please visit our website. We're putting the website information into the chat again. This website is on the ECD, Early Childhood Development Department's website. If you click on that website, it will put you to a workforce tab and you can get these additional resources. Our webinars are posted here, our e-blasts are posted here, research, important research around workforce compensation, and also other state strategies, state, territory, and tribal strategies get posted on the website so you can hear what other people are doing. So please make sure that you are going to that website. Please look for our email. This is really, really important that you look for our email in about a week that will have the link to the webinar and also the link to these resources. And we will send you more information about opportunities to have some office hour conversations about these important topics. Last slide, please. So again, for everyone on the call, we really want to recognize the commitment that you've made to the field. We appreciate each and every one of you. We know in the trenches you are doing amazing work, and the National Centers and the Office of Child Care and the Office of Head Start and ECD, we are all here to support you. So let us know what we can do to support you. Thank you so much for your time. We appreciate you.
Recording stopped.